Go well. Karen Telshaw Johnson is a treasurer for us and a plucky sidekick for me many times as I'm doing these speaking engagements. And we are so grateful to be with you guys today. We are, like I said, a 501c3. We've been around for 22 years plus, but we've got a few new revolutionary ideas. So grateful to partner with Shakita and many others. And just frankly, we'd really like for you to choose a champion today, but we'll let you decide. So when I say choose your champion, it's our rallying cry for encouraging people to make healthcare decisions a priority by choosing an advocate to speak for you in case you have a medical healthcare emergency. You cannot speak for yourself. Now, our dream is to provide all Texans with this information, which is called advanced care planning, and one day the ability to retrieve those decisions for yourself, your family, or for your doctors. So, sincere question. How many of you would like to end your journey on earth by going out in a medical blaze of glory with all of the most important people in your life fussing and fighting and bickering at the end? Or would you prefer something completely different? Today, we're going to talk about the things that are most important to you, and you may not have had a chance to, or you may not have invested the time and the opportunity to think about the story of you. In our modern world, it is really offensive to our modern mind to think that someday, our some days, may be done. But I don't want to start our plan at that vantage point. I want to talk about you today. You see, you are a champion, perhaps for a cause or your family or both, and that's awesome. I'm in the right place talking to the right people today. But I'll ask, who in the world wouldn't want a champion? And I think it's probably the person that doesn't think that they need a champion. And you're right. Today, you don't need a champion. You don't need someone to speak for you. Your world is probably going well, maybe even better than you ever hoped or dreamed or planned. And that's awesome. But how many of you have ever had a planned emergency? I have not. And I submit to you today is the day when you are healthy and in your right mind, or close enough, to articulate these plans so that the people around you can help you when or if you have your healthcare emergency to use your plan. But if today you choose not to make a plan, you have made a choice already, and you will enable the state's plan for you. And that might be fine. It might be great. But let's talk about what the state's plan is, okay? The first person they will ask is you. But unfortunately, you're unconscious. So you're no use, no good to the caregivers around you. So who would be the next option that the state would go to? Well, they would go to your spouse. Unfortunately, you're in the middle of a sticky situation, a separation actually from your spouse, and your soon-to-be ex may not give you the 15 to 20 minutes time you need on life support. So maybe the state's plan isn't working out so well for you. Tell you what, let's take that option off the table and say your ex is out of the picture. Who would they go to next? Well, adult children. If you had children, they would consult them and ask for a consensus. You have had 3 children, and they've never had a consensus on anything in their entire lives. So does this bring them together? It's not looking good. For argument's sake, let's say you never got around to having children. So who would they talk to next? Well, it would be your elderly parents. Now, do you feel like your parents are going to be able to process this information of your sudden accident, illness, probably terminal condition, and make the decision that you would? Probably not. So for sake of argument, let's say that they are deceased. They're not going there. who would the state go to next? The next person up would be your closest living relative. You think, finally, the state's plan is working out for me. My sister's just moved back to Texas, so God forbid I have an accident, she could actually help. Well, the state in its infinite wisdom did not mean your closest blood relative. They meant proximity. So your weird Uncle Al that lives 10 miles away is in the driver's seat, not your sister who's 40 miles away in Frisco. Now that I have your attention, would you like to talk about how to choose your champion? Well, let's do it. Our learning objectives today, the good news is we just hit some major highlights here in the Texas State Code, and I bet this analogy is going to stick with you for a while. Johnson & Johnson are going to help me cover the next two bullets of Section 166 of the Texas Health Code. We'll talk a little bit more about what is a champion, why do I need a champion, and more importantly, oh, by the way, since I am with two attorneys, this is general advice on what the law is about, not necessarily counsel for your particular position. I'm sure I can get an amen from the Johnsons on that. Overview, yes. Who doesn't want a champion? How can I set up my champion today? Because we all love fast, friendly service. Why my patients aren't choosing a champ. And 4, why is this a problem when they don't make a choice? I think we're already making headway in that. Well, let's talk about how we got here. Well, way back in circa 1999, a lot of things were happening. There were many agencies coming in and trying to help us understand what advance directives would look like. And there may be some in this audience who actually helped carve out the language that eventually became Advanced Directives Act. I know Dr. Belfiu was one, George Fine, and others. You see, back then, we felt like that the political atmosphere was so polarized that we probably weren't going to make much progress. And unfortunately, we didn't know about Stardate 2020 because things have only increased in their polarity, it seems. Now, when I started working for Care and Prepare 6 years ago, we were hearing that about 15%, maybe 20% of the general population in this area had advanced care planning done. I hate to say it, we've made some progress, but not a lot. Shakita Johnson will cover that a little bit later. But the question is, we've had over 20 years to try to get some serious results. What are we going to do? What do we do next? I don't know about you, but I've really noticed death is extremely unpopular. It's about as unpopular as taxes. And that's why April 16th is National Healthcare Decisions Day, because once you pay the tax man, you know, you might as well contemplate the other realities of life. Unfortunately, we are not taught how to deal with this. Most of us, whatever discipline we're trained in, we're managing the symptoms. We don't really allow ourselves to lean into this and discover what really are my priorities. We have found that using different language and crafting different approaches can sometimes be very helpful for people. So I mentioned our organization started over 20 years ago. The original name, probably most of you may know us by, is the Coalition for Quality End of Life Care. And when I came on board, I noticed that that name was actually closing more doors than a fire drill. We somehow or another just weren't getting the traction that we needed. And I thought, this is truly terrible, because this is important information for the public, and it's important for us to be able to translate to the general layperson. So we developed some new approaches. One of those, we realized we were caring and preparing, and so we thought care and prepare really explains our mission, and new approaches is really important. Now, one of the other new approaches that I will go with is, some of you may have one of these. This would be an iPhone. And what we've learned in the community is, if you press on the top two buttons, that would be your volume and your power, many times you'll get a screen that looks like this. The second bar in between is your medical ID. Did you know that you can actually put your medical power of attorney in the hands of EMTs and people that may come to help you first? So my suggestion is find your medical ID or your health icon. For me, it's very important that I let people know what I want and what I don't want. For me, I'm allergic to penicillin. You know, that might work for a lot of people. It's just not going to work for me. I also have spelled out who my medical power of attorney are right here. The phone number is there so that EMTs, the hospital, they can get in touch with the people that know what matters to me most. So we also are beginning to create more partnerships. And Shakita Johnson with Area Agency on Aging is a wonderful partner, as well as we're working with many other organizations. Karen Johnson is also with the Alzheimer's Association and is on their board. And I think she has some very interesting cases that she might be able to relate to us on this topic.
We see that you're unmuted, but we can't hear you. Uh-oh.
Is that good?
Now we can hear you.
Okay. So thank you, Leah, and thank you, Shakita, for being with me on this journey. So yes, the cases I've seen and how did I start down this advanced care planning path. My name is Karen Telshaw Johnson, and I do run Telshaw Johnson Law. I do estate planning and elder law and have a lot of advanced care planning conversations in my office. I am the attorney that you will find at people's bedsides, whether at hospice or in a hospital setting as well. Having these conversations in those locations is not ideal, obviously. So how can we do it better? About 10 years ago, and my reason for my passion in this area is that I had a dear friend who had end-stage cancer, and she would call me up and say, I want to do this next, and I want to do this next. In the meantime, she's in the hospital every other week when they're taking fluid off of her body. And I knew enough to know about medicine, but, you know, again, I'm a lawyer. I'm a juris doctor, not a real one, but I knew enough to know that she was in trouble and that all the plans that she had for 4 to 6 months from then were not going to come to fruition. Her dreams were not going to come true. And despite very real conversations with her, and then even bringing on clergy to have very real conversations with her about probably a month to 2 about what she had left, we couldn't get past all of the medical information she was receiving on one more treatment, one more round of chemo, one more round of radiation. Oh, the doctor said if I try this, I'm going to be a part of this study and that this might work. And she was literally in the hospital by that point every other week. And so she wanted to see her son be bar mitzvahed. We could have moved that up. She wanted to meet her 25th wedding anniversary. She wasn't going to meet that, but we could have, had celebration earlier. But she couldn't hear us. So then the end of her life was a wake-up call for me about being in this field and how I can do it better. How can we have a better outcome with people staying in control of their healthcare decision-making and living the best life that they can all the days of their life? And so what I realized early when dealing with her is that she didn't have enough information about her disease process, and that her physicians would not talk to her about end of life at all. They always were talking about the next form of treatment. Transparency creates trust between a physician and the patient. And so that when I find that a physician has had better conversations, or is willing to bring us in, through Care and Prepare kind of as a mediary, to have those better conversations, that trust gets built. And when you have trust, you have hey, I'm having this side effect. Can I have, this kind of, this care for that side effect? I was speaking with a cancer patient recently who was having more breathing issues and really just needed another CPAP mask, and didn't have time to talk about that with the doctor. But when we were talking about how to feel better at the end of life, those very real pragmatic issues come out in, serious conversations, so that we have more time to have that conversation, and we can relay that to the physician so that they can feel better as well. And so, but mortality still sits at 100%. So then not everybody necessarily wants to talk about the very end of life. So what are some easy first steps we can take? What are some easy first steps? And so, Leah, let me have you go back to that, or are we on to Shakita?
I'll just jump in here and say thank you so much. I appreciate that. It is taking first steps. And how are the first steps typically happening in Tarrant County, you might ask? Well, they're non-existent a lot of times. So for at least 80–90% of the people, they're non-existent. The social intervention of providing ACP education with documentation and storage is a radical change from the status quo that Care and Prepare is proposing. We seek for all Texans to benefit, especially those from underprivileged neighborhoods who may not have understood their healthcare rights and responsibilities. Care and Prepare actually participated a couple of years ago and will participate again this year in a NIH study. The research project before was listed in JAMA Network 2020. And the research question was, can a low-cost, easily scaled end-of-life conversation game motivate underserved African-American individuals to engage in advanced care planning? Currently, 25% of African-Americans have ACP planning, and hence they are less likely to have their medical health care wishes known and honored. This more informal approach to ACP has yielded an increase in ACP documentation completion. And we say if we want to increase care concordant ACP wishes and care with this community, then we need better methods of communication in order to decrease the disparity. And that's what ACP for All is all about. Because when we say ACP, we mean ACP for all. So that's our goal, is to revolutionize the complete process of how we were doing this in Fort Worth and eventually for all Texans. Shakita is doing an amazing job over there with her conversation facilitators. And so I'll just let her tell you a little bit about best practices.
Okay. So thank you very much for that. It's so interesting, as you heard with Karen and her friend. The first thought that I would say is just so basic, which is decide to have the conversation. Make the decision to have the conversation, okay? The research on the completion rates for Americans with advanced care planning is just all over the place. It's not a lot of good insight, but the Palliative and Advanced Illness Research Center conducted a study recently. They did a study of studies where they looked at 150 studies that comprised about 800,000 Americans. And the studies were completed between 2011 and 2016. And what they found is that only 36% had completed advanced directives, only 36%. And, you know, Karen, Lee, you guys mentioned completion rates. The completion rates were higher for patients at 38%. But the completion rate for healthy adults was 32%. So not a lot of daylight, in those numbers. So patients and healthy adults are about the same in not completing advanced care planning. So I would encourage you today, as I said, to have the conversation. Also, too, when you're having this conversation, understand all you have to do is plant a seed. You don't have to plant an entire forest. Okay, that first conversation, as was laid out earlier, choose your champion, choose your advocate. Just start there. Just start there, and then you can go on. I would also say, in the experiences that I've had, I know Karen has had the same sort of encounters. Anticipate denial and anticipate that patients and individuals will have an emotional response. Sometimes when we don't anticipate that, we think this is great information. I have so much I want to share. Wait till you hear this good news I have. And then when someone screams or yells or cries or, accuses you of just wanting to, end their life early, it takes us back. And then we get discouraged and we decide, you know what, I'm not doing that again. Okay. So for those of us who find ourselves or have found ourselves in that position, understand that if you are concerned about going forward and sharing that, understand that there are community resources available to you to utilize to have that conversation. So you can still get this information in front of patients, in front of your loved ones. Use resources like Care Prepare, like the Area Agency on Aging, like elder law attorneys such as Karen Telshaw Johnson. We're fortunate in Tarrant County and in Fort Worth in particular, we have so many options and available people who can help you out. So don't feel like you have to go it alone.
Yeah. Thank you so much, Shakita. She has been a part of us and our Care and Prepare physicians developing a program for physicians and patients to explore the concepts of advanced care planning. We use evidence-based conversational templates. You may be familiar with Respecting Choices, serious illness conversations. They come from very data-driven approaches. We utilize that, plus we're marrying it with some new language that is translating well to the lay population. We're also involved in creating a beta site this summer where we embedded facilitators into a physician's office to see how would that work. We're pulling together the data and looking at how many decisions were made, and also how can we improve the program to start our pilot project this spring. I would like to, if we have a few minutes, Dr. Barker actually has been teaching about advanced care planning for over 20 years. And he realized, as he was given another speaking engagement, that what he needed to do was actually model more and to provide a real live scenario for the audience to consider. So this is Dr. Barker, radiation oncologist. He has a patient who has a malignant tumor that has reoccurred. This is him performing on the high wire before grand rounds in 2019. I'm going to play just like 2 to 3 minutes so you can actually see how he teaches as well as how he learns in real time and how he can actually do advanced care planning in his 20 to 30 minute visit.
All right, so
We lost the sound.
Leah, you muted your.
but we did talk about the fact that this is advanced care planning. And we talked a little bit about the fact that you guys have done some sort of advanced care planning up to this point. So tell me what you have done already up to this point. You guys can pass that microphone back and forth if you want. That might work out.
So the second time I got diagnosed in June of this year, we thought that it was a good decision that we set a medical power of attorney up for our children. And just in case anything would happen to the two of us, even though us being so young.
You guys tell me, I honestly can't remember, did y'all say that y'all did that kind of in the context of making wills? And did a whole, like, let's
We did,
prepare a family for whatever, adulting kind of.
correct, that is correct. We did do that. We sat down and filled out some wills and paperwork for that along with the medical power of return.
So do y'all have access to those? This is your time to shine.
Yes.
Where are they? Do you know where?
I have an email and then I have hard copy.
Okay.
So.
So you literally keep access to it, like
Yes.
on your phone?
Yes.
So tell me about the medical powers of attorney. Are you guys each other's medical power of attorney?
I
Is
have
that
no
how you
idea.
have it set up?
I have no idea what that even means.
Okay,
But we went, my mom works for a bunch of lawyers.
Yeah.
So we kind of had the,
all right, so thank you guys for doing this. I really appreciate you.
Filled out some wills and paperwork for that along with the medical power of return.
So do y'all have access to those? This is your time to shine.
yes.
Where are they? Do you know where?
I have an email and then I have hard copy. So.
So you literally keep access to it, like
Yes.
on your phone?
Yes.
So tell me about the medical powers of attorney. Are you guys each other's medical power of attorney?
I
Is
have
that
no
how you have
idea.
it set up?
I have no idea what that even means.
Okay,
But we went, my mom works for a bunch of lawyers.
Yeah.
So we kind of had the inside help. We all sat at a table and they just kind of were like, sign here, is this? So I don't really know what that
That's
means,
perfect.
but
that's great. That's a perfect place to start.
So I do have to add that Madison is my medical power of attorney.
Okay.
And Julie, your mother, is her medical power of attorney.
Okay. Great. News
yeah, the
flash.
more you know.
That's right. That's okay.
So you can see that Dr. Barker elucidated information from them that he did not know. He used it also as a teachable moment. I can also tell you that this event in real time had every person spellbound. I have been creating grand rounds for 15, 20 years. I have never seen every person paying close attention, but it's because of the genius of Dr. Barker. He created a new model. It's usually see one, do one, teach one. Barker is giving his audience the see one, critique one, and then in future do one. He illustrates, this goes on for another 27 minutes. He illustrates that he doesn't have to know everything in this initial meeting with his patients. He is not expecting them to know everything. He's using a teach back method of what do you understand? Where are you in the process? And he's also keeping it on a very personal level, as well as being cognizant of the emotional situation that they're in. I will tell you that Dalton did very well with his treatment. This was in 2019, Baylor All Saints Grand Rounds for the OB-GYN group. He is still doing well, has not needed his champion, even though he has chosen one. I would encourage you all to consider having Dr. Barker maybe do that for your group. I don't know if that would be appropriate or not. I just know that, you know, that old saying, only you can prevent forest fires. Well, only you can prevent you going out in a medical blaze of glory. So please choose your champion today so someone else can speak if you can't. Point your cameras to the QR code if you want to learn a little bit more about choosing your champion or about care and prepare. We'd love to connect with you in future. Thank you so much for your time today. I hope this has been helpful.